psoriasis is another big thing in the exam. So you must know psoriasis. You can describe as a PPP. I highlighted the PPP. So the first P is psoriasis, which is the title of what we are talking about. Then the other P is psoriatic plaque, which means it's very itchy. And we describe it as a fine silvery scales. Fine silvery scales. So these plaques, you can see it, it can be found over the elbow, the scap, the knee, the gluteal folds. But just look at it, is that silvery, fine silvery scale. Another P is what we call pinpoint area of bleeding. It remains in pinpoint area of bleeding remain in the skin when a plaque is removed. So that is your Auspitz sign. All these things are high yield in the exam. What is the Auspitz sign? When you try to remove any of those psoriatic lesions, there is a pinpoint area of bleeding. This is it. It looks like it's going to bleed. Pinpoint area of bleeding. So that is your Auspitz sign. Then we have another P. We have another P, which is the pitting of the nail. So anytime they ask you a question about pitting of the nail, that is psoriasis. Some people get it confused with iron deficiency anemia. What we have in iron deficiency anemia is your clonacea shape nail, not pitting of the nail. Pitting of the nail is the psoriasis. Another thing to remember in psoriasis is the treatment. We are still going to look at the treatment, which is your PUTS. Okay, so this is the breakdown of your psoriasis. P, psoriatic plaque. Another P, pitting of the nail. Don't forget, is a silvery plaque. Okay, psoriatic silvery plaque. Then another P, pitting of the nail. Another P, pinpoint area of bleeding. Then what is the treatment? The treatment, you can use PUT. So what is PUT? P is psoriasis, U is UVB, then ultraviolet, then T is your tar preparation. Another T, topical steroid. Another T, topical retinoid. So this is your treatment: tar preparation, topical steroid, topical retinoid. And of course, people that have psoriasis, you refer them to dermatologists. Then I want to emphasize on another thing we call Koebner phenomenon, still under psoriasis. So what is Koebner phenomenon? Is a new psoriatic forming over an area of a skin where somebody had a trauma, had a scab, or had a scar. So is a new, when somebody had a trauma somewhere, or have a scab, or have a scar, and there is a new psoriatic lesion in that area. It's usually like where somebody have a scar. You had an injury, the injury heals and it forms a scar. So that new psoriatic lesion in that area of scar or trauma or scab is a Koebner phenomenon. And I also want to emphasize on types of psoriasis. You can see the plaque psoriasis. The plaque psoriasis, that is the one that we call the silvery plaque. That is the generally known. Then we have the nail psoriasis, the one I said, pitting of the nail. The one that is highly important to also take note of is the guttate or guttate psoriasis. So that guttate psoriasis, as you can see, how do I know patient have a guttate psoriasis? Patient will complain after they have like a streptococcal infection. So it's always related to after streptococcal infection. Okay, it usually resolves spontaneously within 12 weeks, but this occurs most frequently after a streptococcal throat infection. So you can see a question. This is a long question, okay? And if you read it, I always like to make some questions long so that you can see the background of everything. So from this question, you can see that he reports this lesion began appearing 2 weeks after experiencing a sore throat, which is streptococcal, after experiencing that. So if you look at this is a guttate psoriasis because patients started complaining that after their the streptococcal infection. So again, for emphasis, psoriasis can be triggered off by stress. Psoriasis can be triggered off by infection. Psoriasis can be triggered off by skin trauma. Like we said, area that somebody had trauma before. That is the Koebner phenomenon. So I'm just emphasizing on common triggers for psoriasis. Common triggers. It can be stress. It can be infection. The one for the infection is the guttate psoriasis. The guttate one. Psoriasis. It can also be caused by medication, blockers, lithium. And I mentioned the treatment that they can use the tar preparation. I also mentioned the retinoid. I also mentioned the bleeding. And I said that the bleeding, we call it the Auspitz sign. And we have the pitting of the nail. Pitting of the nail. So please always remember that pitting of the nail. So just for more emphasis, pitting of the nail. So it can look something like this. Pitting of the nail.